This is a video showcasing several case studies where patients were suffering from some type of TMJ involvement in their case. Normally when I put these videos together, I'll put my oldest video first and then newest videos as we go on. However, in this video, I'm going to put one of my newer videos first because it has a really great explanation of how the TMJ is involved with movement, dystonia, Tourette's, and other syndromes. And that way, when you watch the following videos, you'll understand the role that the TMJ has in muscle testing or muscle strength. So that's going to be this video. We're going to start with Brian, and this is a very good video to explain how the TMJ works. Then we're going to do Lily, Ernie, Carl, Brody, Pink, and lastly, Aubrey. This is a teaching video. In this video, we're going to be discussing the TMJ. We're going to watch a little clip with Dr. Vincent Clark, and he's going to talk about TMJ's impact upon his son's health. We're also going to watch a video clip where putting in mouth guards and gapping the TMJ changes patients who have dystonia and Tourette's and makes them much more normal. When I found this video, I thought how interesting. We chiropractors have been dealing with the TMJ for 100 years, and it's good to see that science is validating some of these concepts. This is a great case study because Brian has a TMJ issue, a TL issue, and pelvic floor injury, all contributing to his dysfunction. Let's watch this case.
How much better were you after your last visit? Yo, crazy. A lot better. A lot better. Like, I want to say like 95% better. Okay. Honestly, like, me and my wife talked about it. We waited like I want to say like a day and a half, 2 days to see and talk about how I really felt, and I am feeling a lot better. Yeah, I'm feeling a lot better, honestly. Good. It was weird. I don't know. Last time did he work on my leg or something like that?
I did.
Yeah, cause I suffered, bro, from my left calf. This right here would always be like I feel like I just put it on an intense training session. You know, so I'll wake up in the morning, and then today I woke up and I was just like, I was starting moving, and I usually move and I feel the tightness, but I didn't feel it today.
Try this one. Push out for me. Push out.
Okay, hips.
Both hips or just?
I was doing physical therapy for my partial torn ACL.
Okay.
I had a 25-pound ball weight, and I was doing squats, keep my core tight, and doing twists, you know?
Okay.
Doing a cross. And when I turned, I felt like a little snap, like a pop in my hip, because it's always felt weak when I was training Mississippi.
So both hips or mostly the right?
Mostly the right hip, but not.
Push out.
Push out.
Bend this knee for me. Don't let me pull.
Oh.
Try this one. Bilateral hip weakness like that is uncommon, by the way.
Right.
Now, during his exam, we can see that his muscles timing is off. And because I know of his mixed martial arts, I thought we should check his TMJ.
Open your mouth. Right. Push up.
And it changes almost all of his muscle function except for the right latissimus dorsi.
Push up. Good.
Push out for me.
Good.
Try this. Push towards me. Okay. Push towards the door. Good. Push towards your hip. Okay. Try that one again. Ready? Arms straight. Don't let me pull. Almost fixes everything. Push towards your hip.
I clench my jaw. I bite my jaw a lot. Close. Open. Oh! Good.
You ready? You get warm?
Yeah, I did.
Push up for me. Okay, there we go. Go. Yeah. So your jaw's been out, so it's deactivating all your muscles. Push up for me. Good.
What?
Go.
My jaw has been out?
Yep.
So it's been deactivating all my muscles?
Technically, it's causing a lack of stimulation to an area of your brain called the cerebellum. So it's causing your sequencing and your timing to be off. predisposes you to an injury because your muscles are not firing as fast.
Yeah, exactly. They're not firing exactly what I want them to do.
Correct. All right, so here we're going to take a segue. We're going to watch this video of this doctor. He talks about his son, and this is a great case study about medications and the TMJ. We're going to tie that back in.
So this is a picture of my son, Ryan. And Ryan got a syndrome called complex regional pain syndrome. He twisted his ankle. His ankle got better, but a few weeks later, the pain came back, and it didn't go away. And this is a picture of Ryan's legs, and you notice that the leg you see on the right is a different color than the one on the left. That's a part of the syndrome. When he hurts himself, his body shuts down blood flow to that area. That lets cytokines, histamine, all those nasty chemicals build up, and they actually cause a secondary pain issue on top of whatever caused the pain issue to begin with. It's a really difficult syndrome. It's been tough for him, tough for his parents, tough for all of us. The doctors, very good people, very nice people, they really wanted the best for Ryan, put him on some medications, and a few months later, he started to get these episodes. He would just collapse spontaneously and go into spasms. They could go from a few minutes to hours at a time. Sometimes he would get dystonia, where his body would completely lock up. He'd be unable to move. It got really scary when he had trouble breathing, and we checked him into the hospital. When he was in the hospital, the doctors ran their tests and basically said it must be psychogenic, and psychogenic's a code word for the kid's a little bonkers. They thought it was all mental. We weren't convinced, though. This is a very sane, very bright kid. We took him off his medications, and it turned out to be a side effect of one of the medications he's on called amitriptyline. And he's actually very sensitive. He actually gets these kind of symptoms to a lot of different medications. So as of today, he's pretty much medication-free, at least in terms of prescription allopathic medication. But we needed another alternative for him. And he still has a lot of issues. He gets relapses. He'll hurt himself. He'll go back on crutches in a wheelchair, whatever. And we can't give him drugs now, but he needs help. He needs a way to get over that pain. It turns out that there is this really interesting, unexpected benefit to simply biting down on a stack of tongue depressors. So this is Ryan, and I have some movies here. Let's see. So Ryan had been in a wheelchair for about a month before this movie that you see here. We just gave him a stack of tongue depressors to bite down on, and this was literally the first time he walked for a month. It seemed incredible, but it turns out that I think there's a benefit to this that's been completely overlooked by modern medicine. Now, it's very old. You remember, a long time ago, before anesthesia, they would give people something to bite on when they did surgery. The assumption was that so you didn't bite down so hard that you break your teeth. It turns out there's a brain effect of biting, separate from any of that. It causes analgesia, and it can correct a lot of symptoms of motor syndromes that are currently really untreatable by modern medicine. So this is Ryan a couple days later, and we actually built him a little mouth guard that you'll see in a second he has in his mouth. And at this point, he was getting better. You notice the color change starting to go away in his leg. And within a few days, he resumed physical therapy, and he was completely out of the wheelchair within a week or so. So it was just a spectacular change, completely without medication, and very effective. And now, you know, he still has bad days, but he has a lot of good days too. There's other symptoms that this helps with.
My symptoms were twitching, barking noises. I would twitch my neck back and forth, cause myself whiplash. I mean, I've always looked at people and just wishing that I could just stay still.
So that's a young man with Tourette's syndrome. And in the beginning was before he got a mouth guard, and afterwards was after he was treated by a dentist for some TMJ issues. And his Tourette's basically disappeared with the use of that mouth guard. Then there's another story. This woman, after a car accident, developed some really nasty issues with muscle control. She had a lot of trouble walking. And this is the first time she tried just biting on a stack of tongue depressors. And just immediately, that problem resolved. Again, she'd been to dozens of doctors. Neurologists like to call her syndrome psychogenic. They think it's psychological, and it may be, I can't say. But why would she respond to this when she hadn't responded to the last umpteen doctor visits that she'd been to? Why? What's so special about biting down? And there's many other patients too. I can show you dozens of examples, individual examples of patients that benefited. This fellow had Blepharospasm. It's basically dystonia of the eyelids, very hard to open his eyes. When he puts something in his mouth and bites down, his eyes just pop open. And that look of surprise is basically just opening his eyes, but also being surprised that it works, you know. This is a fellow who, after an accident, had to use a cane most of the time. He put a stack of tongue depressors in, and he threw down his cane. And it's just like being in a revival meeting when we get patients in. It's incredible. Here's another fellow with Tourette's, and with a mouth guard. It's hard to see a little bit because it's taken from a movie, but again, it resolved. He was on, I think, 8 or 12 different drugs at this point. With a mouth guard, he doesn't need them. This is a woman also who had a lot of issues. She actually had pain syndrome, much like my son Ryan's. And for her, it progressed to this really advanced state where she'd get all tied up. And with tongue depressors, she just loosens up and can walk and so on. So I'm intrigued. We're doing some imaging studies. And like TDCS, it's hard to come up with a control. But one thing we've come up with is different thicknesses of mouth guards. It turns out that a thin enough mouth guard is basically ineffective. It doesn't produce this benefit. So we try different sizes of mouth guards. We're doing imaging studies. One of the things we've noticed is that with thicker mouth guards, you tend to see this effect in the cerebellum that isn't there with thinner mouth guards, or when people don't have anything at all in their mouth. So that's one piece of evidence that it's altering brain networks. Biting down alters brain networks. This is the result of a larger study, a total of 12 patients and a few healthy controls mixed in to increase the N. This is the interaction of the effect of performing a voluntary movement by rest with biting down on something in your mouth, either tongue depressors or a mouth guard, versus relaxation. So 2x2 design. This is the interaction between those two, significant with an FDR of 0.05. And you see a lot of brain areas alter their response depending on whether or not you're biting down.
So now let's go back into our case with Brian, and you can see the impact that the TMJ has upon human function.
Oh, geez. Now, you rest for a little bit, okay? Brian, how was that? That's good. Yeah, why'd you think the jaw?
Well, I used to do mixed martial arts. It's common that, you know, guys are choking, you know, rear naked chokes.
So
And
you're holding the mouthpiece and stuff like that.
but, you know, they go for the choke and you put your chin down and they're forcing your chin and your jaw joints into your joint.
Okay, yeah. I'm so used to using my chin and like pressing down on that arm. Yeah. You know, that little pinch is not that pinch anymore.
It's less?
Yeah, it's less. I feel good. I feel good. It's weird, man. It's like magic.
On your side. Don't let me pull. So I'm checking his left hamstring. Remember, it's his left knee that had the injury and his left calf. And the reason I went to the TL junction is because previously Brian had demonstrated that he had pain in that area. Okay. All right, so this is some trigger point work, and I'm going to speed this section up.
Ah! 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 Ah!
You like that?
Ah! 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 Yeah, let's go.
You ready?
Yeah.
I want you to put your toe up. I'm going to try to straighten your leg. Do not let me.
All right.
Here what I'm attempting to do is to separate whether it's Brian's hamstring or his calf that's actually out. So even after the adjustment, he's still showing that left hamstring weakness. So after trying all these different things, I made the decision to try Brian's pelvic floor. Remember, Brian said he had an injury while squatting, and the pelvic floor, when you lose stability in that, you can lose stability in distal muscles, in this example, the hamstring muscle. So that trigger point therapy helped facilitate that left hamstring, which should also help through muscle chains support his left calf. On a technical note here, it's very common for males and females to injure that pelvic floor while squatting. It's also very common for females to have an injury after childbirth to that area that doesn't get corrected. How's that?
Oh, crazy, bro. Yo, that's insane. I'm like mind blown, bro. You're like voodoo. This is crazy. No, yo, this is crazy. Yo, man.
Thank you.
Yo, thank you. Thank you.
They do feel slightly different.
Which one feels more? I'm going to push down towards the table, you push up towards the sky. You ready? Push up. Push up, go. Push up for me. Open. And close. I'm going to give you a little push. Open. And open. One more time. Open.
Oh. Wow. Woo. Okay. So.
You're going to feel difference in a second. Do whatever you want. You ready?
Ready?
Push up. Good.
Oh, wow.
Push up.
Oh my goodness.
Push out. Out. Great.
I
Push
totally feel
out.
a difference. I actually feel
Better, actually.
energy.
Yeah. Don't push. Perfect. Don't push. Perfect. You also feel less depressed today. So you've been suffering from a mild depression, right? Yeah.
Big time. Big depression.
Yeah, you're going to feel a lot better, I promise.
Oh my gosh, this is incredible. Yes.
So I'm going to fix your electrical system. We're going to change your diet little by little.
Okay.
How do you feel?
I look sweat.
Yeah. So you're going to feel your palms get sweaty. Feel that?
Yep.
Yeah. So that's
Wow.
everything working like it's supposed to.
You are amazing. Oh my God, this is great.
How do you feel?
I feel happy that I found somebody that can actually fix me.
Well, we're going to fix you together. So.
Yes, I've been wanting to do this for a long time. I just, yeah, wow, I just feel much better.
Yeah. You're going to feel a little more mentally clear and a little more
thank God.
and a little more mentally present. So you've been kind of in a fog.
Big time
Yeah.
fog.
Yeah. So that jaw, when it's out like that, it diminishes your brain's capacity to
Wow.
work. Hop up for a second and walk around and just see how you feel. Tilt your head up.
Oh, I can't breathe.
I got you. You're not going anywhere.
Okay. Woo! Whoa. Wait.
I got you.
Okay. Again?
No, that was it.
Oh, okay.
I'm not letting you fall.
Okay.
All right.
Wow. Oh my goodness. Woo. Oh my goodness. All right.
How's that?
That was incredible. Woo. Whoa. That was crazy. Oh, I
Try
felt
this.
everything.
Close your eyes.
Well, get through that. Ah!
Really switch your feet for me. This is your harder side.
It is my harder side
so we're gonna see.
because this leg was not working for a good year. I had all my power on my right,
I want you to feel the difference.
totally different. Okay, I'm actually able to stand now. Wow.
That's your visit for today.
Oh my gosh. You are amazing. I'm so glad she sent me here. If you can do all you did on one visit, wow. Usually I have to come back, and I don't even get half.
Don't worry, I've been taught by the best.
Oh, who were you talking
I've
about?
been taught by some amazing human beings.
That's awesome. That is really great.
Plus, I'm amazing.
Shoot. Yeah, I concur. Totally.
Doc, from the top, you ready? You push up, go. Good. Try some push up. Good. Try again, go. Try this one. Go. Go. So, go. So these are your inhibitory reflexes, and they should be weak. Doc. Go. Okay, so that's more normal for the. Go. Doc, push out. That's normal. Push out. That's normal. Push out. That's normal. Push out. That's normal. Arms straight, push towards me, go. That's normal. Did you get warm from that adjustment? You did.
A little bit, yeah.
Means you've been out for a long time is what that means.
Yeah.
Belly pull. That's normal, okay? You push up. Push up. So far you're batting 100. Go. That's normal. Have you had that jaw?
No, never had that adjustment.
Hi everyone, this is my patient, Carl. Carl is in today for a jaw issue, neck issue, and a little bit of hip and his back. Carl, push up. Good. Carl, try this one again. Push up. Okay, so Carl's quads are working really well. Plantar reflex is working bilaterally. We're going to do a deep tendon reflex with a muscle test, and that's working. So those are good. Push up. Good. And try this one. Push up. Okay. Ooh. Try again. Go. Right lat is not facilitating. This is activation of the right tonic neck reflexes. Push up. Which should cause facilitation of the right gluteus medius. Push up. And does not. So those are both abnormal. We're going to look at the patient's jaw for deviation. Patient's jaw opens, shifts to the right, and then shifts left. So there's 3 muscle groups we're hitting here in the mouth. They're all very painful. I like this patient because he doesn't scream that much when we do care. Move that around, Carl. See how that feels.
I think I gained about 8 degrees range of movement.
One large masseter muscle. Patients have a tendency to gag on this a lot. It's a very tough muscle to work on. So after we did that trigger point work on his masseter muscles, his internal pterygoid, we're actually going to go check to see if his upper posterior muscles are working and what impact they have, and see if it corrected actually that tonic neck reflex test we did earlier. So now his right lat's working. Okay. His left lat is not working. He probably has a strain to his left latissimus dorsi muscle, which we'll correct with trigger point work. I'll turn your head to the right for me. Push up. Great. Turn your head left. Don't push. Okay, so that trigger point work in his jaw actually caused a correction of the tonic neck reflexes. Turn your head right. Don't pull. Oh, Carl, you're good, bro. Don't pull. You go walk, see how your neck, back. How you feeling, Carl?
A lot better. I think the jaw adjustment really helped with the neck pain and some of the hip pain as well.
Let's try this. Bring this foot to your back. Go. Good. Try again. So we're trying a Gallant Reflex on Carl. It should cause the weakness of this hip. Try again. It's not, so that's abnormal. We're going to check a L5 on the left. Carl usually responds very well to L5 adjustments bilaterally. Don't want to straighten your leg. Go. Carl's also a young male who's stronger and bigger than me. You know, sometimes you can get patients who are outside of your muscle testing strength curve. Carl might just be there. How you feeling, Carl?
Pretty good.
Better?
Much better.
Do we need to do your back?
Sure.
You relax. Relax. Good point.
I came to see you last week. I was 100% better. It's the first time in 4 months I've actually slept well.
Wow.
So massive difference there.
This is a great teaching video. In this video, what you'll notice is Brody's having weakness of the muscles around his left shoulder. What I'm attempting to demonstrate here is you can find areas of dysfunction that are causing areas of dysfunction somewhere else. Let's watch this case study and see if you can answer the question I'll ask later on. Brody's come in today to have his left shoulder and his hips checked. First, we're going to examine Brody. I had a suspicion that Brody was having some type of TMJ issue, so I stuck a tongue depressor in his mouth to gap his jaw. I went back and rechecked all his muscles. They facilitated, so he went from weakness to strength with the tongue depressor in his mouth. Then I went back and did something called an optokinetic tape. This is down and to the right to help mimic movement for the left posterior semicircular canal. And I adjusted Brody's right TMJ. I did trigger point therapy on the muscles of mastication in his oral cavity and on his skull. I did a thoracic distraction. I did a left-sided C7 adjustment. And lastly, I blocked Brody to untorque his pelvis. This is that case study. Brody here comes from LA, and he used to have Franco Colombo as his chiropractor.
For 25 years. When I found you, I instantly knew you were the man.
Push up. Go. Push up. Go. And push out. Don't let me pull.
No, I have nothing else.
Push that way, Brody.
Go push this way. Okay.
Ready?
Yeah.
Go. All right, let's discuss Brody's case for a moment. Brody has global inhibition. All of his muscles are not working properly except his right pectoralis muscle. Also a left-sided hip flexor weakness. So we're seeing an inhibition of his left side. Brody also explains during his exam that he has left hip pain and left shoulder pain. So when we test those muscles, what we notice is that they are also weak. I place a tongue depressor to gap his jaw. The jaw is impacting and causing his body not to respond properly. What happens is his left pec is not working before the exam. After we place the tongue depressor in his mouth, the left pec does not fire up. However, all of his other muscles do. Keep it there though, I want to see something.
Okay.
Don't let me push.
Okay.
All right, fix it. Don't let me pull.
Okay.
Keep it there. Push up.
Okay.
Great. Push up. Wonderful. Push up. Good. Push up. Okay, so your jaw's out.
Okay.
Push up. This is an optokinetic tape. We're going down and to the right. And it's to stimulate left posterior semicircular canal motion. Usually this type of motion or movement fires up posterior muscles. In Brody's case, that would be his latissimus dorsi muscles, which are necessary for stabilization of that shoulder. What is interesting is he did have an increase in strength or facilitation of that left pectoralis muscle. I did not anticipate that. This is a simple illustration to show what Brody was seeing. We were going down and to the right, and this was causing his eyes to jump. He would look at each red and then jump to the next red and then jump to the next red. And this was to mimic, once again, motion of the brain and the neck and head with movement. Here I'm looking at Brody's TMJ. Typically with a patient like this, I would prefer to adjust on the left side. However, his jaw is disarticulating and it's going towards the right, not the left. So I'm going to adjust on the right side. While it's not what I neurologically would prefer to do, it's what he's showing on the table at this point in time. Get warm?
I don't even know. That was just weird. That was awesome.
Arm straight. Push towards me.
Oh, that's a lot better.
That's a lot better. Arm straight. Push towards your hip.
Oh my god, that's crazy. Yeah. What the hell was that?
Well, your jaw's out.
That is crazy.
Oh, and close. Forgive me. 5, 4, 3, 2, 1. 5, 4, 3, 2, 1. You'll like me when you get off the table.
Okay. Ooh.
Did you get warm?
Yeah.
Yeah, you did, right?
Yeah.
Okay. Let's check your arm out.
Okay.
Push towards me.
That's so much better. It's crazy.
Go walk for me for a little bit, and then we're gonna.
How do you feel?
I mean, I feel good. I mean, I felt so good from last time. It was so much better. I mean, last so much better.
Quick question. Why not adjust both sides of the jaw, both sides of the neck, and both sides of the pelvis? Why do any muscle testing or exam at all?
Oh, that was crazy.
On your back. Straight. Push towards your hip. Okay, that's better. Okay.
That's so much better than we started. Oh yeah, perfect. That felt great.
So at this point during our examination, Brody has all of his major muscle groups that are facilitating properly, and I'm checking for something called the Gallant Reflex. His Gallant reflexes are abnormal. When I make this stroke on his low back, he should have a weakness of his hamstring muscle. He does not. I place the blocks in until we find that weakness that is normal with this test, and that I leave Brody in that position for a while to allow his pelvis to untorque. Don't let me pull. Good. You relax for a little bit. I'll let you relax on those.
When you first tested my left side of my arm, I mean, it felt like literally I couldn't have lifted a 2-pound dumbbell. And then when you finished, I felt like it feels almost strong again, like not 100%, but really, really, really different. I saw a physical therapist where I thought did a good job. So at least he got me out of some pain when you were gone. But nothing like this. This has been amazing. Yeah, that was crazy. Thank you so much.
Thank you.
That was spectacular.
Thank you. Legs straight, ready?
Yep.
Push up. Robert, you can have a seat, please. Push up. So this is Brody. Been a patient for a while. Have some little back issues. Comes in periodically. Push up.
I'll push up.
Try it. Go.
In fact, it's simply due to proprioception input or versus something else.
Push up. So it's a big change, right?
Yeah.
Now if I want to, we can pick which side. So we can go from one side like this.
Okay.
Push up. You got hot off that, didn't you?
Yeah.
I can feel the heat coming off. Go. Go. So we are not going to be adjusting push up that left side of his. We're going to just. Let's recap this. So initially we muscle test Brody and all of his muscles are inhibited, meaning they're weak. This is one of the reasons that he's having lower back pain, is his muscles are not turning on fast enough. And he's obviously a powerful, well-built male, and he should be able to resist these tests. Through this demonstration, they appear weak. I gap his jaw, and once again, we go back and retest his muscles. We notice that all his muscles fire up. Now, this is not magic. This is neurology. We're activating cerebellar inputs. I'll put a little video in a moment. And when we take the tongue depressors and put them very specifically, I can actually determine which side is out. So when we do his right side, his muscles facilitate and his body heats up because it's a neurological component. When we put the tongue depressors on the left side, all his muscles go weak. So I'll be treating Brody's right side in this video. This is a segment from a different video discussing the TMJ and how certain mouth guards activate certain areas within the cerebellum. And this is a little video clip demonstrating how this patient who had a car accident and had a movement disorder called dystonia, she put the tongue depressors, one on top of the other, on a particular side of her mouth, and the fluidity of her movement came back. And once again, this is because it activates certain areas within the brain. The brain has a better coordination and sequencing and timing and firing so that the body can work as it's designed to.
Continuing ed students.
Oh, that's great. How is that going?
Very good. Yeah, you're always coming up with some really interesting things.
Yeah, that's great. How often do you guys get together?
A couple times a year, generally.
Patients who have TMJ issues usually have one side that's predominantly worse than the other. For example, I have a TMJ issue, which is on the left side. Anyway, with Brody here, we're doing the internal pterygoids and his masseter muscles. These are very tender and they're tight, and they can be painful for the patient. Forgive me, forgive me, forgive me. And he gets warm, so when patients get warm like that, it means they've been out of place for a long time. And you can feel the heat wave like that come off of patients. In certain patients, whenever you stimulate the right area that needs to be stimulated, a patient's blood flow will increase. With increased blood flow, more blood means more heat. And so patients will have this heat wave that comes off of them after treatment. This is very common in my practice. Also, we're noticing that Brody's muscles are now facilitating and working properly. So this is how simple TMJ and adjustments help the body in its coordination. Did your back hurt, or what's the...
It hurts a little on the left quad. Like maybe just a little here.
Go walk for a second. Here what I'm doing with Brody is doing some basic aromatherapy to see what impact it had on his low back. I haven't really done this before with Brody, so it's more of an experiment to see if it changed anything. And it did diminish his low back pain. So what we're doing here is we're having the patient smell through one nostril to activate one hemisphere of the brain versus both nostrils. And this is to help that hemisphere work better. The smell is the only sensation in the body that does not cross over. It does not desiccate, so it stays on the same side. So I want to see what impact this had on Brody. It's still hurting a little bit.
I don't feel it at all right now, actually.
Really?
Yeah, I'm 100% bet.
I think we're doing a straight trigger point, and then we're calling it a day. How's that feel?
I feel great.
Yeah.
Yeah. You did a great job last time. Though. I feel good.
This is my patient Stacy, and I want to showcase this study because Stacy has something that I have not witnessed in practice before. Go, Stacy! Push up. That's great. Now, obviously, when we gap a patient's jaw and they're having some type of TMJ dysfunction, the patient's muscles will facilitate. This is normal and this is not uncommon. Good. Checking one side. And usually we'll put the tongue depressors on one side. Go. She does not have a... And it will not, in this case, fire Stacy's muscles up. Inhibited. That's also normal. What is abnormal is usually when we put the tongue depressor on the opposite side. In this case, it happens to be the left. We have facilitation of the muscles. We do not have this in this case. This is the first time I've seen a need to bilaterally gap the TMJ to cause the patient's muscles to facilitate. Do we have an increase in strength? I think I'm adjusting on both sides. I haven't seen this before. I normally don't adjust patients on both sides. Stacy's mother. Stacy's been a patient for 4 or 5 years now. This is us several years ago in our youth. Ready? For sure. There it is. Go. You have jaw issues then, huh?
I guess. What am
Open. 5, 4, 3, 2, 1. 5, 4, 3, 2, 1.
I would tense up before you got down. I did watch him do a gag reflex thing that was, I'm sure, uncomfortable for him, but the outcome was really cool.
So put down a little bit under your shoulder, on this hand behind your neck. Push up. Push out. Good, push out. Okay, let's go get you to walk and see how you feel. How do you feel?
Good.
As I tell my patients, they like me when they get off the table.
What is that, like quasi-motor? Like I don't feel so... I don't know if you could tell I was trying to sit here with a straight back as long as I possibly could.
Are you saying you feel better?
I do. I feel a lot better, thank you.
Yeah.
I feel tall. I feel light. I feel like I maybe dropped the 20 COVID pounds that I put on. That everybody put on. I'm basically surviving in pajama clothes now.
Thank you. Okay.
Thank you.
Mama.
Thank you.
Really happy to feel better. Thank you. Appreciate it. Yeah. Thanks for giving me the chance to treat you. I appreciate it. This is my patient Aubrey. You can see that her balance was poor before the exam and better after treatment. We're going to do a low back adjustment. We're going to use tongue depressors to assess which side of the TMJ is not working in combination with muscle testing. Then I'm going to adjust her right TMJ. And finally, I'm going to adjust her cervical spine. This is that case study. This is a finger to nose exam. And it measures cerebellar function. And her finger should touch her nose. So it's a little off, right?
Yeah, I missed my nose.
Try this one. So we're going to check the other side. Point your finger. Tip the finger, tip the nose, nice and slow. And here, once again, she should touch her nose. And she missed again. So she missed on both sides. This is a manual muscle test exam. All the muscles in green are the muscles we're going to test. They should all be strong in this exam. So as we go through Aubrey's test, she's having no ability to resist on these muscle tests. Each different test measures a different muscle. This is the gluteus medius muscles, and they are weak on both sides. This is her left pectoralis. It's weak. And then her right pectoralis, and it's weak. So she's weak on both sides. So with her, because I know her case, we're going to gap her jaw using some tongue depressors. Open. Right. We're going to go back and recheck all her muscles. Push up for me. Go. So this was the exam with Audrey. All her muscles were inhibited. Nothing was strong. Nothing was working. Then I put in those tongue depressors, gapped her jaw, and all of her muscles start to work. So this is how joints that are out of place can cause dysfunction in other locations of the body. Now both glute medius are firing up. Kind of a difference, huh? I'm going to take it out to simply confirm. And all her muscles are weak. Push up. I'm going to put it back in. And this time we're going to put it on one side. We're going to put it on the right side. Push up. And that makes all her muscles strong again. So this is the side that's having dysfunction. Push out. So now both of them are working those muscles. We're going to switch sides and go to the left side. And all her muscles go weak again. So this is telling us that her jaw is playing a role in her body's dysfunction.
I think so.
I'm going to do a little trigger point therapy. Actually, I want you just to open your jaw a little bit on the muscles inside her mouth. Let's help loosen them up. And then I'm going to adjust that right jaw. Close, open, close, and open for me. There, you got it from two angles. I'm going to go back and recheck the muscles without the tongue depressors in. And remember, these muscles weren't working last time, and now they're working. And this is what we want. Okay. I'm going to have you tuck here. I'm going to give her a little thoracic adjustment. Glute towards me. All right, up you come. Let's go get you to walk in the wall. What I like to do with my patients is have them walk after treatment, because I want to see when they get back on the table and we redo our exam what impacts it had upon their muscles. So her balance is off, which tells me she still has things that are out of place. So we're going to do a little trigger point work, a little massage on her upper erector spinae muscles. This will help her head and her neck move better and have less tension. Here I'm going to adjust her L5. Pull you towards me. Not her sacrum. Okay, a little push. I also want to take a look at her neck. and see what role it's playing in her stress levels actually. And it's around C2, C3 that it's out. That's the area that I'm going to adjust in this video.
Ugh, it hurts. I like that.
Did you get warm?
Warm.
When I touch a patient's hands like that, I want to see if they're perspiring after an adjustment. And if they are, it means they've been out of place for a long time. Aubrey was sweating, which means she's been out of place for a long time. These are the tonic neck reflexes. They're working properly. Tells me her neck is good. We'll have her walk and move again. Hey, I'm running just a few minutes. Am I running?
That hurt?
Do you feel calmer?
Yes.
And we recheck her balance. It's not perfect, but it's better than it was previously. It's not perfect, but it is better. Young lady, thank you for giving me the trust in services. Thank you.
Thank you so much.